Federal Medical Center Jalingo hosts Jalingo Goes Pink Breast Cancer Awareness Campaign. The Federal Medical Center Jalingo recently held a significant event as part of Breast Cancer Awareness Month with the theme Jalingo Goes Pink. During the event, the medical director, Dr. Aisha Shehu Adamu, highlighted the directive from the Ministry of Health to promote early detection and screening as a means to improve treatment outcomes for breast cancer. She emphasized the importance of this campaign in both raising awareness and honoring those affected by the disease.
It's a day meant to create awareness on breast cancer through early detection by screening, self-breast examination, and of course early visiting. Apart from early detection, we're also interested in focusing attention on diagnosis, treatment, and also research. Research is very important in breast cancer so that we'll be able to come up with cure at least, so that people that have been affected, okay, either through acquiring the disease or knowing someone who has acquired the disease, can be positively impacted. So we, as a tertiary healthcare, will go through all the gamut of early prevention, treatment, research, and even teaching. So this day is meant to create awareness mainly to the public and also bring us together so that we can honor those that have been affected, their relations, our mothers, our sisters, our daughters, some even our fathers, because breast cancer can also affect males as well. So this is a very, very significant event to us, and I'm happy you're all here to celebrate it with us and to honor those that have been affected.
Dr. Michelia Joseph Umwajim, key speaker at the event, gave a comprehensive presentation on breast cancer, stressing the need for proper information to reduce the disease's prevalence. He covered risk factors, stages of breast cancer, prevention strategies, and the need for support and rehabilitation for those impacted.
In most countries worldwide, breast cancer still stands as the most common cancer in more than 95% of the countries. Okay, it accounts for over 2.3 million cases in 2022. In fact, previous data have also shown similar figures, and a mortality of over 660 individuals. Here in this country, it accounts for over 25% of the cancers diagnosed. The figure is over 32,000. And we believe it's actually much more higher than this because we do not really have a lot of data, and most of the people do not even present to facilities where they can be captured. So one of the biggest challenge in breast cancer management is depression, loss of members of the body, because for even anybody that will undergo amputation, whether it's a limb, anywhere, it's not an easy thing to take. Not to talk of a breast for a woman. It's a very, very difficult thing to take, especially a young woman, probably unmarried or somebody desiring to have children. So this is a very big challenge. But then you are weighing the risk against your life. And you will need a lot of people around you to really give you support. So spouses are supposed to be there with us in supporting the patients, other family members, clergy. In other places they have support groups just like they have for HIV and the rest. They have support groups where they encourage each other, they talk to them about these people that have gone through all the process will now counsel and encourage those that are just starting. And I think with time we can start that in this center.
The event culminated with a road walk through Jalingo town, raising awareness for the campaign and spreading the message of early detection.
We don't come here to tell you the disease where they affect women breast. We want to tell you, say, as a woman, make you try your every day to check your breast. If you notice, say, the skin color don't change, if you notice, say, your breast they bring out water or blood, If you notice say there's swelling or something hard in your breast, make you kuku rush go Federal Medical Center Jalingo where they go check you. Breast cancer they kill so many women. It don't kill over 28,000 women for Nigeria. We know one make more women die.
Dr. Marwa Adams, chairman of the Federal Medical Center Jalingo Planning Committee on Jalingo Goes Pink, while speaking during the screening exercise, described breast cancer and emphasized the need for women to self-examine their breasts.
Breast cancer, as we rightly say, is there's the affliction of the breast by the cancerous cells. Okay, and it's really a debilitating disease. That is why the emphasis that's why we now emphasize globally, and then that's globally through the World Health Organization, and then even the Nigerian side through the Federal Ministry of Health, and of course the Federal Medical Center. Okay, because of the fact that this is a disease that once it starts, most people are ignorant about it, because you will just see a lump in the breast that is painless. Before you know, the disease has gone far. Okay, diagnosis entails the history and clinical examination of the patient. Okay, and even if you see that breast looks as if the patient has a breast cancer, that's not enough to say that is breast cancer per se, until you did the biopsy. So you take a biopsy, then the histology results will now confirm that this is breast cancer. That is when you know that, yes, what you're dealing with is really breast cancer.
Some of the women present at the screening ground had this to say.
Knowing that cancer doesn't have a cure for now, I guess they say prevention is better than cure. So based on what I know, early detection is actually better, because it can actually help you in managing whatever symptoms you're having. So I guess for me, just a fear of the unknown, trying to know my body better.
Yes, actually, I heard that this breast cancer of a thing is in heredity. My mom had breast cancer and one of her breasts has been cut off. So I feel I should just come for this screening. Let me check myself so that I'll be 100% sure. That's why I'm here.
I came for the screening to first of all serve as an example.
In Federal Medical Center Jalingo, I am Sarah Egger reporting.